The first 3 minutes of a medical emergency can save your life or quietly steal your future, and most seniors still spend those minutes doing the exact wrong thing. If you want to stay healthy and independent as you age, hit that subscribe button right now. We share simple, science-backed health tips like this every single day. Here's the thing. After years of watching how emergencies unfold, one pattern shows up again and again. It is not always the biggest symptom that causes the most damage. It is the delay, a strange wave of dizziness, a heavy chest, a numb arm, slurred words, a sudden feeling that something is just not right. You tell yourself to wait. You sit down and hope it passes. You check the internet. You call a family member first. And that is where trouble begins. So today, I want to give you a simple 3-minute technique you can remember under pressure. Not a miracle cure, not a trick from social media, just a clear plan to help you act fast before help arrives. Now, before we continue, tell me your age and where you're watching from in the comments. This helps us understand who we're helping. Here's what most people get wrong. They think a real emergency always looks dramatic. They expect crushing chest pain, a collapse to the floor, or a face that suddenly droops like in a movie. But real life is often quieter than that, especially after 60. A 2023 survey from the Ohio State University Wexner Medical Center found that 32% of Americans were not confident they would know if they were having a heart attack. Think about that for a second. Nearly 1 out of 3 people might miss one of the biggest warning signs their body can give. And stroke is not much better. A 2024 study from Yale School of Medicine looked at nearly 150,000 stroke patients and found that 54% arrived at the hospital more than 2 hours after symptoms began. Why does that matter? Because stroke treatment is like trying to save a house from a fire. The sooner the firefighters arrive, the more of the house they can save. Let me be clear, I am not telling you to panic over every ache or every flutter. A 2024 report from Indiana University School of Medicine and Regenstrief Institute showed that more than 42% of low-risk chest pain patients had severe anxiety, and 3 out of 4 screened positive for panic disorder. So yes, not every scary feeling is a heart attack, but that is exactly why you need a plan. Not fear, but a plan. That plan is what I call the 3-minute save routine. Stop, alert, verify, enable help. It is simple enough to remember when your mind is racing, and strong enough to help you make smarter choices under pressure. Number 5, stop the clock. Most people think they should keep moving, finish what they were doing, or walk it off. But actually, the first thing you need to do is stop and mark the moment. Why? Because emergency care runs on timing. Doctors do not just want to know what you feel. They want to know when it started. If you suddenly feel heavy chest pressure, new shortness of breath, a strange cold sweat, sudden weakness, new confusion, or trouble speaking, stop what you are doing right away. Sit down in a safe place. If you are standing in the kitchen, sit at the table. If you are in the yard, sit on the nearest stable chair or step. Do not keep cleaning. Do not keep cooking. Do not go take a shower first. And please, do not start driving. Why is the clock so important? Because treatments for stroke and heart problems work best early. A 2024 study from Yale School of Medicine found that more than half of stroke patients got to the hospital after 2 hours had already passed. That is a lot of lost time. And lost time can mean lost brain function, lost strength, or lost independence. So what do you do in that first moment? Say the time out loud. It started at 2:14. If you can, type it into your phone. If you cannot type, look at a clock and remember the closest minute. If someone is with you, tell them, symptoms started now. If the symptom began when you woke up, then the key time is when you were last normal, not when you noticed it. That detail matters more than most people realize. Can you see how simple that is? Not guessing later. Not saying, oh, maybe an hour ago. You are creating a timestamp, like putting a date on a letter before it leaves the house. Number 4, alert help first, not family first. Most people think calling a son, daughter, neighbor, or spouse is the smart first move. It feels natural. It feels calm. But actually, if this is a stroke, heart attack, or collapse, your first call should be emergency services. The Ohio State cardiologist in that 2023 survey said it plainly: do not drive yourself and do not let a search engine decide if you are having a heart attack. Let professionals decide. That matters because help starts before the hospital. Paramedics can check your heart rhythm, start oxygen if needed, alert the hospital, and shave off precious minutes. Here is exactly what to say. Give your name, give your address first, then give your age, then say the main symptom in plain words. I am 72, I have sudden chest pressure and sweating. Or, my speech is slurred and my right arm feels weak. Then say the time it started. If you live in a gated community, give the gate code. If you are alone, say that too. Short sentences, clear facts. What if you feel embarrassed? What if you are worried it is a false alarm? Look, the bigger mistake is waiting. Emergency teams would rather come and find out you are safe than arrive late to a problem that grew while you were trying to be polite. Quick question. Have you ever brushed off chest pain, sudden dizziness, or weakness and hoped it would go away? Comment yes or no below. Number 3, verify with 2 fast checks. Most people think an emergency check has to be complicated, but actually, you can learn 2 fast checks that cover the most dangerous problems seniors often miss. The first check is for stroke. Use Be Fast. Balance, eyes, face, arm, speech, time. Are you suddenly off balance? Is your vision suddenly blurry or gone in one eye? Is one side of your face drooping? Does one arm drift down when you lift both? Is your speech slurred or strange? If even one of those shows up suddenly, treat it like a stroke until proven otherwise. That B and E matter more than people think. A 2024 University of Kentucky review noted that the old fast approach can miss up to 14% of strokes, especially when balance and vision changes show up first. That is why Be Fast is so useful. It catches more of the quiet, sneaky strokes that do not read the script. The second check is for heart trouble. Ask yourself 4 quick things. Do I have pressure, squeezing, or tightness in my chest? Do I have pain or heaviness in my jaw, back, shoulder, or arm? Am I suddenly short of breath, sweaty, or nauseated? Do I feel weak, faint, or deeply unwell for no clear reason? If the answer is yes to several of those, do not explain it away as gas, stress, or age. Why do seniors miss this so often? Because the body stops shouting and starts whispering. Not always a hammer on the chest, but sometimes a belt tightening around it. Not always sharp pain, but a deep wave of weakness. Not always collapse, but a sudden feeling that your body is not right. Have you ever had that feeling? That is exactly why this check matters. Before we go further, if this is making sense so far, hit that like button. It tells me you want more videos like this. Number 2, use the right helper, not the wrong one. Most people think they should swallow random pills, drink water, lie flat, or walk around to get the blood moving. But actually, the right help depends on the symptom. One smart move can buy time. One bad move can make things worse. Let's start with chest pain that feels like a heart attack. A 2024 study from Harvard T.H. Chan School of Public Health found that if adults took aspirin within 4 hours of severe chest pain, it could avert 13,016 heart attack deaths each year in the United States, even after accounting for bleeding risks. That is a huge number, but here is the key. Aspirin is not for everyone, and it is not for every emergency. If your main problem looks like stroke, meaning face droop, arm weakness, speech trouble, sudden vision loss, or sudden loss of balance, do not take aspirin unless a medical professional tells you to. Why? Because some strokes are caused by bleeding, and aspirin can make bleeding worse. If your symptoms strongly fit a heart attack, and your doctor has already told you aspirin is safe for you in that situation, or emergency dispatch instructs you to take it, chew 1 regular 325 milligram aspirin or 481 milligram baby aspirins. Chewing works faster than swallowing whole. But do not take it if you are allergic to aspirin, have a history of stomach bleeding, had a bleeding stroke, were told never to take it, or are unsure and cannot get guidance. Now let's talk body position. For chest pain or breathing trouble, sit upright or slightly leaned back. That can make breathing easier. Loosen tight clothing around your neck or chest. For sudden faintness without breathing trouble, lying flat may help blood flow to the brain. For a person who is vomiting or very drowsy but still breathing, turning them on their side can help protect the airway. And what about breathing? Slow breathing is helpful, but only as a support tool, not a delay tool. A 2024 report from Indiana University School of Medicine and Regenstrief Institute found that anxiety is extremely common in low-risk chest pain patients. So yes, panic can make symptoms louder. Try breathing in for 4 seconds and out for 6. That longer exhale helps calm your alarm system. But do not let a calmer feeling trick you into canceling help too soon. Number 1, enable rescue before rescue gets there. Most people think once they call, all they can do is wait. But actually, the last part of the 3-minute technique may be the one that saves the most confusion when things get worse. After you call, unlock the front door, turn on the porch light if it is dark. If you live in an apartment, unlock the building door if you can. Put your phone on speaker, bring it with you. Set your medication list, allergy list, and ID by the door or on your chest if you are sitting down. If you use oxygen, keep it nearby. If you have pets, close them in another room if that can be done quickly and safely. Why does this matter so much? Because emergencies are messy. People forget their address, they drop the phone, they faint before help arrives. They cannot answer the door. By preparing the path, you are building a runway for help to land faster. Now let me say something that could save a life. If the person becomes unresponsive and is not breathing normally, that is a different emergency. Start hands-only CPR if you are able. Call, push, shock. That means call emergency services, push hard and fast in the center of the chest, and use an AED, which is an automated external defibrillator, if one is nearby. A 2024 study from Duke University found that women were 14% less likely than men to receive bystander CPR and defibrillation in public. And Duke also noted that bystander CPR doubles the chance of survival. A 2022 study from Emory University found that bystander CPR can double or even triple survival, and the best results come when it starts in the first 2 minutes. So if you ever witness a collapse, do not freeze because the person is older, female, larger, smaller, or dressed in a way that makes you hesitate. Action matters more than awkwardness. I'd love to hear your story. What made you click on this video today? Share in the comments. Let's pump the brakes for a second. I'm not saying this to scare you, but to keep this safe. This 3-minute technique is a bridge, not a diagnosis. It does not replace a doctor. It does not tell you which emergency you have. It helps you avoid the most dangerous mistake, which is doing nothing. Aspirin is one of the biggest places people get confused. It may help in some suspected heart attacks, but it can be dangerous for some people, especially if you have an aspirin allergy, active bleeding, a history of stomach ulcers, a recent bleeding stroke, or you take certain blood thinners. If you are not sure, this is the kind of thing to ask your doctor about before an emergency ever happens. And slow breathing can calm panic, but it should never be used to prove you are fine. Some people feel better for a few minutes and then crash hard. If symptoms are sudden, unusual, or severe, or if they come with weakness, confusion, fainting, blue lips, severe shortness of breath, or pressure in the chest that lasts more than a few minutes, get medical help right away. So you're convinced, but thinking, how do I actually do this? Keep it simple. Start by writing the SAVE routine on a card today. Stop, alert, verify, enable help, put it on your fridge, put it by your bed, put it in your wallet. Next, build a tiny emergency kit. Not expensive, not fancy, just practical. Keep your ID, medication list, allergy list, doctor's number, emergency contacts, and if your doctor says it is appropriate for you, chewable 81 milligram aspirin. Keep your phone charged at night. If you live alone, think about a wearable alert button or a simple daily check-in plan with someone you trust. And practice once a month. Yes, practice. Stand in your kitchen and say, symptoms started at 9:12. I am 71. I have chest pressure. My address is... It may feel silly, but in a real emergency, practice turns panic into motion. And motion is what saves time. Look, there is a lot of noise out there. Too many miracle tricks. Too many dramatic promises. But when your body sends a real warning, you do not need a perfect plan. You need a simple one you can remember when your brain feels foggy. You don't need to overthink this. Start with just one step today. Write down the SAVE routine and put your medication list where you can grab it fast. That alone puts you ahead of most people. Your body will tell you if something is wrong. Your job is not to be brave and wait. Your job is to notice, act, and make it easier for help to reach you. That is how you protect your brain, your heart, and your independence. If this helped you, hit that like button. And if you want more videos like this, make sure you're subscribed because we post new health tips every single day. Stay healthy, stay strong.